Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr.Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. I am also the medical author of the book Focus Neurology. My email is 3klpm@gmail.com. Today we are going to talk about a very interesting topic, the abnormal facial movements, cranial nerves part 50, facial nerve part 6. The abnormal facial movements. Abnormal facial movements. Some conditions involving the face produce abnormal movements rather than weakness. Some conditions involving the face produce abnormal movements rather than weakness. Common disorders include abnormal facial movements. Common disorders causing abnormal facial movements include aberrant regeneration because of facial nerve palsy, Blepharospasm, hemifacial spasm, and facial myokymia. First, let's talk about the hemifacial spasm. Hemifacial spasm arises de novo because of intermittent compression of the ectatic arterial loop in the posterior circulation, most often a redundant loop of ICA, anterior inferior cerebellar artery. Because of the intermittent compression of the ectatic arterial loop in the posterior circulation, most often a redundant loop of the ICA. The compression is usually near the anterior aspect of the root exit zone. The pathophysiology is similar to that in some cases of trigeminal neuralgia. The arterial pulsations are thought to cause demyelination and focal nerve damage, leading to epileptic transmission and ectopic excitation. Microvascular decompression is sometimes done and may effectively halt the movements. Synkinesias following peripheral facial palsy may cause movements resembling hemifacial spasm. However, the essential difference is that synkinesias is provoked by a voluntary movement, whereas hemifacial spasm is a spontaneous involuntary contraction. Babinski's brow lift sign is seen only in hemifacial spasm. But what is Babinski's brow lift sign? It consists of a co-contraction of the frontalis and the orbicularis oculi, causing spontaneous eye closure and paradoxical elevation of the eyebrow during a spasm. Blepharospasm causes involuntary itching that primarily involves the orbicularis oculi and frontalis muscles and is a form of focal dystonia. So Blepharospasm is different from hemifacial spasm. Blepharospasm is always bilateral and fairly symmetric. Meigs syndrome is association of Blepharospasm with oromandibular dystonia. The patient with tic habit spasms can suppress the movements, while the movements of hemifacial spasm and Blepharospasm are totally beyond volitional control and cannot be suppressed. So habit spasms can be suppressed, whereas hemifacial spasm and Blepharospasms are totally beyond volitional control and cannot be suppressed. Now let's talk about facial myokymia. It is a continuous involuntary muscular quivering that has a rippling worm-like appearance. It is usually unilateral and seen in numerous conditions intrinsic to the brainstem. It's a classic feature of multiple sclerosis, Pontine tumor, the Pontine glioma, and Guillain-Barré syndrome. The facial nucleus itself is usually intact, but the process disrupts its connections, possibly disinhibiting some neural generator. So these are the fascinating concepts of abnormal facial movements. I hope you have enjoyed listening to these concepts. The other important concepts of neurology, I put it in a question answer format written in a book, Focus Neurology, written by me, Dr. Sreenivas. This book is available online from all leading booksellers, including Amazon. If interested, this book could be bought online from Amazon. I hope you have enjoyed listening to my concepts of facial movements. If you have enjoyed it, please share the link. But do like and subscribe my YouTube channel, Dr. Sreenivas Medical Concepts, and my web page, Dr. Sreenivas Concepts. Thank you. Bye.